Welcome back to the podcast. Today, we're going to be talking about leadership. And if physicians don't take control and lead ourselves, that means someone else is going to be leading us. We have on the show Dr. MinhTri Nguyen, who is a medical oncologist, hematologist at Stanford. Prior to being at Stanford, he was at Case Western, where he was the medical director of the internal medicine clinic at Metro Health Systems, chief resident, and president of the House Officers Association. He was named one of Northeast Ohio's top 25 under 35 for his work on improving leadership training for physicians. So, Dr. Nguyen, thank you so much for being on the podcast.
Hi, thank you so much for having me.
Before we get started, first, a word from our sponsors. Hey, this is Brad Block, host of The Physician's Guide to Doctoring. This is a personal and professional development podcast for physicians where we have experts on the show that try to teach us everything we should have been learning while we were memorizing Krebs cycle. And we're back. Okay, so Dr. Nguyen, I like to lead off with a story. So tell us, what inspired you to get trained in leadership?
I've always had an interest in leadership, and it started very young, like even when I was in like junior high or whatnot. But I got to be honest with you, when I tell people I have interest in leadership, it tends to be like a little bit pretentious, right? People think that I'm like trying to look like vie for a leadership position, and that's not what.
That's immediately what I thought. Immediately, right. That's what I went to.
Right.
Who is
like,
this guy?
That's not what I mean by that. And of course, I say this during my interviews while I'm looking for a job, and people automatically think, oh, here's this young guy wanting a leadership position. So what I mean by that is I find at the core of it, human behavior fascinating, extremely fascinating. So I studied this when I was in undergrad. I studied this when I was in high school, but psychology is interesting to me. So why somebody does what they do based on whatever learned responses, emotions, etc. So my interest in leadership is trying to figure out this psychosocial sort of dynamic of what do leaders do and why do leaders do that? And not only in just the leadership, but also the followship as well. Why do people follow these people? Why do people like certain leaders? At the undergraduate level, I was involved in a couple of classes that were related to leadership and change. And I met really great mentors. I met my old professors who taught me, and they eventually became my mentors, and then even my friends. I had advisors who were advisors to me when I was a student leader. And so I learned a lot from them. And then eventually it got to the point where I thought, how can we incorporate sort of all of this stuff that I learned in the field of leadership into medicine? So I started thinking about leadership in terms of medicine and physician leadership. So that's essentially how my journey started and where it is today.
That's really interesting. I was listening to an interview with you, and there were a couple of things that came up during the interview. I apologize for the listeners. I can't remember which podcast it was on, but he's been on a couple already, and they're great. So check them out. Actually, one of them was with a mutual friend of ours, Dr. Scott Allen, who I had on the show a couple of years ago. And during like high COVID times, we did an interview about not being afraid of Zoom lectures, of being the remote lecturer and how to do it effectively. And I went to a podcast conference, and lo and behold, he was there, and we ended up hanging out the whole time. And he was the one that introduced us, MinhTri and myself, to do this interview. And he's all about leadership. So definitely check that episode. One of the things that was discussed was that like physicians have inherent leadership skills that are part of us that we practice daily and don't realize that we're doing it. And one of those things, it made me think of something a mentor once told me, which is if there's a void in leadership, fill it until someone more competent arrives. And that is like, for instance, in a code. Right? The patient's coding, you take charge. If you're a resident, if you're an intern, take charge until the fellow arrives. You just, if there's a void in leadership, fill it. If nobody's in charge, you take charge, right? And sometimes that happens to us in other ways. Like, for instance, we end up getting promoted to leadership roles with no leadership experience.
Yeah.
And it can be overwhelming. So with all your leadership training and leadership experience, what advice do you have for physicians who end up in these leadership positions that are like thrust on them, right? They may not have any interest, and yet there they are.
Yeah. The problem that you're stating there is just, it's so prevalent for physicians. What I would say, and I don't know if this is like salient advice or anything, but what I would say there is that physicians already have the tools to succeed in this field and in other types of field. I think as individuals, physicians are very good at adapting and also learning. So I find that great leaders continually learn. And when we're put into positions, leaders and physicians in general are put into positions where we feel like we lack expertise, then there has to be that curiosity there to figure out ways to improve ourselves. I would say physicians do this in general. Don't feel like because you're so underprepared for this that you can't learn. And that is, I think, the trick to all of this is that great leadership can be learned. It's not something that you are just born with. Some people have innate skills, yes, but you can earn sort of these skills throughout time, and you can also find people to help you get you there. So by all means, it happens to us because, of course, we focus our entire lives into learning medicine. And then we get to this place where, yes, we're promoted and sometimes we're not prepared for it, but there's time to learn and you can learn great leadership.
So, what are some of the skills that we have already as physicians that then translate into leadership? Like one of them being active listening, right? Daily, every single patient, we need to actively listen. And so that's one of the things that makes a good leader, right? Is actively listening to the people that you are leading. So, what else do we do daily or have we done in our training that would translate into being? So, you mentioned one, you mentioned the fact that we adapt and we learn. And then I just mentioned active listening. Is there anything else that as physicians we already have in our quiver that would make us good leaders?
Yes. So communication is huge. And I'm going to hone in that just a little bit more because you talked about active listening. There's also a lot of great things that we learn as clinicians, and that is having difficult conversations with patients, with families, with even our own staff. These difficult conversations happen in leadership roles as well. And so utilizing what we learn from those communication skills in those settings are applicable to leadership challenges as well. We also learn as physicians when it comes to communications, being able to express ourselves clearly, utilizing language that may be appropriate for the audience. And I think these things are very transferable from clinical expertise to also managing delegation and leadership expertise. Now, if we go away from the communication skills, what other things do physicians exude that can help them with leadership? I like to call them like the 3 A's for what I believe to be great leadership practices, right? We talked about one being adaptable. I think the leaders are adaptable. There's just not one leadership theory or one leadership style that fits all situations. In the same sense, adaptable physicians are the same way. Not everything has to follow an algorithm. Sometimes you have to step out of that algorithm and find other solutions. The second A is authenticity, alignment. Great leaders are authentic. Great physicians are authentic. When you are empathizing with a patient, if you're not authentic, they'll know. And in the same sense, if you're a leader and you're trying to lead a whole bunch of people and the mission of the organization or the group isn't aligned with yours, but you're trying to make it align by forcing people to follow, they'll get it. Like, the authenticity matters. And I think that's what physicians really help to bring into the role is we know how to be authentic because we've wanted to do this for certain reasons. And if we're true to that, people will see it. The last A, by the way, is just allowing others to lead. Physicians have to learn to do this, but I think leaders also have to learn to do this. And that is that sometimes being a great leader means that you don't lead all the time. You allow others to step in. Nurses will lead us and our patients will lead us. So will sometimes our social workers, et cetera, et cetera. So in a team that's non-clinical, you also may have some players there that may want to be able to lead and should lead in certain situations.
You got to let go of the reins a little bit, helping others succeed, right? It's not just all about accomplishing your goals, but helping them accomplish their goals and allowing them to lead and facilitating that. So you're still leading, I think.
It's servant leadership. And I think it's also a really good succession planning. If you're a good leader, you really should have good succession planning.
We talk about work-life balance all the time, right? I'm so overwhelmed with all the stuff I need to do, right? Delegate. The more you can train other people to take some of these responsibilities off your hand, facilitate their leadership. Like, it seems like hypocrisy to complain about the lack of work-life balance and then not let other people lead when there are opportunities to give over some control. So it all fits together really well.
Yeah, it's that old mentality of the lone wolf healer who just has to do everything by he or herself.
Yeah, that's where, like, when we're in training, right? Well, in medical school in particular, right? We're competing with each other for grades and position and spots, residency spots and fellowship spots. But then at the same time, we also have to put that behind us and work as a team, even while we're sometimes competing with each other.
Yeah.
So one thing that you speak a lot about is emotional intelligence. And so emotional intelligence specifically in leadership. So actually, I want to talk about emotional intelligence, one, in leadership, and two, in the exam room. But first, let's just define what emotional intelligence is.
Sure. There are many definitions, but the way I see it is it's very simple. You, and then there's the other. So emotional intelligence is having the ability to recognize and manage your own emotions, to regulate your own emotions. And then there's the second part, which is recognizing and having the ability to manage or regulate emotions that are in the environment. That's my simple, clear definition of emotional intelligence.
All right. And so how does that then influence your particular leadership style?
I think if we just rewind a little bit, I want to speak back to what I was talking about with human behavior, because leadership and I think just delegating and teamwork, all of that has to deal with behavior. And I think as humans, we'd like to believe that a lot of our behaviors are driven by reason and logic.
Social media says otherwise.
So in actuality, our emotions play such a huge role into why we do the things we do and our behaviors. Why not understand that, not only for ourselves, but for other people? And I think leaders are able to, if they can, when they can recognize those things, work with individuals and work with, I think, large groups of people to affect change, using emotions as a means to motivate, using emotions as a means to understand. And just, I think that's like the real core work that we do in medicine anyways. And so it seems so easy to marriage the two, medicine and leadership, with emotional intelligence.
Give me an example of what you mean, because when you say using emotions to manage human behavior, it sounds like that could very easily turn into using fear to manipulate people. Like, how are you utilizing it?
I think the most important thing for great leaders is to use emotions to understand people and create relationships, right? Yes, you can use fear to motivate someone to do something, but we know that with fear, this is like an immediate thing. It's not a long lasting thing. So if you are the type to think about utilizing fear as a means to motivate, it's not a long lasting plan. But if you create relationships, if you understand why people behave based on their emotions, you can understand them. And I think in that way, you can work with them and they will understand you and create that trust. So a situation would be, say, in the setting of a leader, say there is somebody who continues to procrastinate and you're having a really difficult time having them turn in assignments or do something that could help the team move forward. I think then is a really good time to show some emotional awareness with them and ask them, I want to understand why your procrastination is happening. Is there something that inhibiting you from doing the work that's needed for the team? And sometimes we come to find out that there's a fear of disappointment that comes from unresolved feelings or emotions that may be rooted way back when. But maybe there's something that is at play with your follower and you that sort of brings out that fear of disappointment. And so they put off doing the assignment because they fear that it's not perfect enough. So there's a lot there that I think can be explored to unlock a person's potential.
Are you their leader or therapist?
So you got to draw a line, obviously.
It's like you're getting a little deep there with that one particular follower.
You can go as deep as you want. But what I'm trying to state here is that you can form these relationships with people on your team. And I think once you form that trust, they're more likely to open up these issues that they may have, which could potentially be blocking them professionally. Personal problems don't just stay personal sometimes. They do blend into our professional lives.
And it sounds like that also can be utilized in the exam room, right? With patients, that same emotional intelligence. So my question for that is, how do you teach emotional intelligence? Because something that I've spoken about on the show before and had other people tell me in interviews is not just to listen for content with your patients, but to listen for emotions and then respond and respect those emotions, recognize those emotions verbally when they happen. If you've got someone who just, that's not their style, that's not what they're like, how do you teach them that?
So there's a lot of ways to teach emotional intelligence. But before I get there, I want to just say something about emotional intelligence in the exam room and into what you're talking about. I think sometimes when patients ask us a question in the exam room, they're not looking for a practical answer sometimes. They're just looking for an emotional response. And that's all that you need. So I don't think a physician always has to give a pill, a
Like a
number.
significant thing.
Exactly.
Sometimes
But
they're just looking for you to listen and acknowledge what they're going through.
exactly. And I think as clinicians and physicians, we tend to weigh ourselves on the I'm the fact knowledge person, so let me just give you the answer here, as opposed to they just might want you to give them an emotional response to what they're going through. So now back to your question about how do we teach emotional
Wait, hold on.
intelligence?
Like, how do you know what they're looking for? If you're looking for like a concrete answer, take this medication, stop this habit, whatever it might be, versus just commiserating with them and understanding what they're going through.
Clear communication is always great. If you like, you gave a very good example of that with a relationship with your significant other, which is right. I want to help you in this situation. Tell me what you would like for me to do. Would you like me to be a listener, or would you like me to give you a very practical answer in this scenario? You can try it that way. Some other ways that I think is maybe more intuitive for me would be you can always start with an empathic phrase or an empathic response. And if that's not enough, you can tell the patient might just be hanging on to some, like looking at you, hoping for some more. And if you want to include clear communication there, then you say, is there something more that you would like me to add to that? Multiple ways of doing this. You can be very clear from the beginning. You can start with empathic or empathy, and then you can go forward from there.
I just want to acknowledge the listeners right now because I want to acknowledge the fact that your patients are asking a lot of you. They'll come in with complaints and they'll tell a story that has very little semblance of any order to it. It'll be chaotic in the way that they're explaining it. And you need to make order of that chaos, of the information they're giving you. You need to listen to it for emotion. You need to acknowledge the emotion. You need to be able to figure out if they're looking for a solution or just looking for you to acknowledge what they're going through. Then you've got to examine that person, come up with a diagnosis, come up with a plan, and communicate all that effectively in a very small period of time. So I just want to acknowledge the fact that you've got to do that many times a day. That is really hard. It's really hard, and it can be mentally and emotionally draining. I'm just putting that out there. It is. What we do is hard. So
Yes.
Dr. Nguyen is asking you to add another layer of difficulty to that because that's what the patients need. It doesn't change the fact that's what they need from us. It's hard, and what we do is hard, and that's what they need. So I'm sorry to interrupt with that because I just want to acknowledge that it's like we're going to take this exam and make it even harder. And that's, yeah.
Yeah, you can totally ignore the emotional component. I think it behooves us in knowing what you just said, that maybe this is why we should master these skills so that it doesn't become hard. It's not an added stressor to the exam clinical appointment. It actually just comes naturally to us. Not to say that I'm any like naturally doing this or whatnot, but I think if we are more focused into it, we can gain insights on how we can improve it if we know what we're doing right and what we're doing wrong.
Yep. I don't know. I'm definitely getting better over time because I'm keep trying to push my limits and master these. So it's getting easier, but at the same time, it's getting harder because I keep pushing myself to get better and better at it. I had someone recently, and I just said to that person, listen, you did everything you could have possibly done to prevent this from happening, and it happened anyway. There was nothing that you could have done any differently. And they were asking me questions over and over, the same questions over and over. And until I said that one thing, they would have kept asking those questions. So I needed to see that. And I'm sure I've had countless patients where I didn't pick up on that, where I didn't say that thing that they needed to say. But yeah, but it behooves us to keep dialing in and keep trying. But let's get back to leadership. Let's go back. We stepped into the exam room. Let's now step back out of the exam room. And I'm going to ask you a really big question, okay? And that is, what differentiates a good leader from a great leader?
I think if there's just one thing, it would be that a great leader continually tries to improve and learn. They have a curiosity about being a leader. They don't believe that what they have is a fixed skill set, that they have already attained great leadership, that it can't be improved upon. In the same way that I think being a good physician, you have to stay in tune with new changes to the field. You have to be constantly changing and improving your skills as a physician. I think the same applies for leadership.
And let's say you were standing in front of a medical school class, right? You were in charge of the medical school curriculum. They said, you know what, we're going to wipe out the Krebs cycle. They don't need to learn that anymore. They don't need to memorize that because they can just Google it. And you're going to now teach a class on leadership. What are some of the major points that you're going to want to make there that you haven't made so far?
Yeah. Some schools do a really good job of this already, but I would emphasize on this a little bit more. I would focus less on fact finding and memorizing knowledge, team dynamics, teamwork, rotations within the team to signify leadership roles so that it's not just one or two people constantly leading. You have to put people in leadership roles in the same way physicians are promoted to leadership roles without being prepared sometimes. I think that sort of teamwork, like the problem-based learning, can be applicable in these situations where a team has to work on a problem, because that's what ends up happening in the clinical world and non-clinical world. I think the focus shouldn't just be clinical for us to help each other learn as leaders. In multidisciplinary teams, if a medical school can put teams together where it's not just medical students who are all going to be doctors one day, but incorporate a team full of non-physician future and situations where they can learn from, I think that would be very important.
So you'd have someone from the PT school and someone from the pharmacy school and someone from the business school and someone from the nursing school and a physician, have them do team projects together.
This is a huge ask, right? But there are some schools that already incorporate pharmacy students with medical students, right? So yes, it's still clinical work, but we don't just come out and only work with physicians. We work with all sorts of people. So I think if we can include that sort of dynamic in medical school, then all for the better.
That's a great idea. Hopefully someone with some leverage in that situation is listening. Someone in a leadership role already that has that type of influence.
Yeah, I hope so.
What would you say to the physicians who are a bit further on their careers and maybe they're a bit jaded about the feeling like, I don't want to take a leadership role because I don't think it makes any difference. All it's going to be is a bunch of people sitting around a table that like to hear themselves speak. Nothing ever gets done, or just that there's so much that needs to get done that they feel like this is pushing the rock up the mountain, right? It's just too much. It's too hard. And everyone just likes to hear their self-talk. Like they're just so negative about it. And on top of that, they already have enough responsibilities between their full-time job and their clinical roles and their life outside the hospital. So they're frustrated and they don't have time. What are you going to tell that person? Because they're definitely listening to this show right now.
Yeah. So let's talk about leadership and let's talk about emotional intelligence. Why would leadership be really important for the physicians who are already so busy? Leadership amplifies, I think, certain aspects of your role as a physician that I think can only give you back time. One, it amplifies delegation skills. So when you're a person who can delegate better, then you can be more efficient with your work. Leadership skills also amplify teaching skills. So your resident, fellow, nurse, etc., you can follow your lead a little bit better. You can be more clear in your direction to them and also be able to lead them towards what you want them to learn. And as it relates to emotional intelligence, there have been many studies correlating emotional intelligence with physician wellness, less burnout. There have been studies that have related physicians with emotional intelligence to better patient satisfaction, better patient outcomes, even as far as physicians with great emotional intelligence have lower litigation risk. So I think if you want to make the case, do I need to learn these skills? I would submit to you, these are some of the benefits.
All right, I'm sold. So what you're saying is it's an investment. So you make the investment in learning to become a leader. So the question was more like, I'm so overwhelmed. Why should I take on more work in this leadership role? And what you're saying is by learning leadership skills to make you a better leader in that role, this is going to translate to a more efficient workday.
Yeah.
Because you're going to be able to delegate more and you're going to be able to communicate with both your staff and your patients more efficiently and effectively. So then you'll be done with your work faster. So that makes sense. So then you can choose to use those skills to either go home earlier and enjoy your family or to take on additional work, which is what a lot of us do, right? You get a little bit of free time and you decide to fill it with more work, which is what we shouldn't do.
Well, let me add to that, because I think there's another component here for why you should focus on leadership, right, as physicians, right? Because I talked about this in some of the other podcasts I've been in, but I think healthcare has fallen out of our hands for some time now. I think physicians deserve to be at the helm of healthcare. And the problem that I'm sensing in my experience as a physician is that we wish healthcare to change, yet we are not at the helm to change it. So I like to encourage physicians to think about ways that we can be in a position to change it. And it starts with accumulating the skills and being curious about ways in which we can step onto the podium and tell people what we're seeing from the ground level. I think that's when we can make this a little bit better for all of us and also not have to be burned out every day with the concern that people aren't listening to us. I think maybe we get up there and we tell people what they should listen to in terms of what we're seeing.
Again, I'm sold. Fantastic. If more people want to learn about you, about your style of leadership, where's your online presence? Where can we find you?
You can find me on LinkedIn. That's probably the best way right now. I'm usually pretty active on there. So you can just search my name and my institution, and you should be able to find me there. I don't know if you want a link or something. I can probably send that to you as well.
When I looked you up, not many MinhTri Nguyen's, a lot of Dr. Nguyen's out there, but you're MINH capital TRI is how you spell it. So you're pretty easy to find at Stanford. So we'll find you there. And thank you so much for your time and all you do for our profession.
Thank you. You too, as well as everybody else and your listeners.
Thanks for listening. So please share it or like it or comment on a social media post or write us a 5-star review. Thank us again for listening to The Physician's Guide to Doctoring.